On ultrasound imaging, many a time you will come across small fluid within the endometrial cavity. So you have to look for the differential diagnosis. What are the reason of these small fluid within the endometrial cavity? If the fluid is in small amount or in moderate amount or in gross amount, you have to be very careful for giving the diagnosis. It could have been due to any carcinomatous changes, any stenosis, any polyposis, any instrumentation, any abnormality related to congenital diseases. So therefore you have to be very careful while you are looking and you come across with small fluid within the endometrial cavity. So you must put this on your report, and in the differential you mention what are the reason for the small fluid within the endometrial cavity.
This list shows causes of endometrial fluid. Many a time when you scanning the patient either transabdominal or transvaginal, so you may come across small to minimal or moderate fluid within the endometrial cavity. There are certain reasons. These are the differentials which are responsible for the endometrial fluid. It includes congenital abnormalities, like if there is imperforated hymen, so the fluid or blood will retain in the endometrial cavity, or there is vaginal septum, like there is septated vagina, so still there will be fluid retained within the endometrial cavity, or there are certain other Mullerian duct abnormalities. So because of congenital abnormalities you might see endometrial fluid. If the patient is currently menstruating, so still you will see small fluid or small amount of blood within the endometrial cavity. In case of pregnancy, there may be endometrial fluid if the pregnancy is in early stage. So look for the viability of the pregnancy. If there is fluid around, so there is likely chance of miscarriage. So always look for the viability of the pregnancy. If the patient is been through recent instrumentations or trauma, so endometrial will show small or minimal or moderate fluid collection within it. It will show some infections as well. After the radiation, there is likely chance of endometrial fluid. Many a time certain cancers required radiation, so post radiation there will be endometrial fluid collection. In case of any infection, maybe candidiasis or other microbial infections, or maybe because of any gonorrheic infection, there will be small fluid within the endometrial cavity. In case of cervical stenosis, if there is cervical stenosis due to any reason, maybe because of cancer or because of tumor or because of polyps or because of radiation, if cervical area is stenosed, internal or external os is closed, so there will be fluid collection within the endometrial cavity and you will see endometrial fluid on the ultrasound imaging. In case of any obstructing lesions, either these obstructing lesions are because of endometrial or because of cervical causes, there will be fluid within the endometrial cavity. So these are the differentials for the fluid within the endometrial cavity.